Ready to explore the dark side of the American dream? Capital City Theater presents Stephen Sondheim and John Weidman's Tony-winning musical Assassins, a bold, provocative journey through the minds of 9 individuals who changed or tried to change history by targeting the President of the United States. From John Wilkes Booth to Lee Harvey Oswald and beyond, their stories collide in unexpected, eerie, and even darkly funny ways. Don't miss this gripping and unforgettable production running August 1st through 10th at the Playhouse in the Overture Center. Get tickets and more information at capitalcitytheater.org. Ready to boss up? Madison Magnet is Dane County's premier young professionals organization. Magnet aims to give young professionals a place to connect, collaborate, and develop. Joining Magnet gives you access to a network of 250 plus young professionals, free access to 40 plus events per year, and an opportunity to join committees or the board of directors. Membership starts at only $30. Sign up today to get access to all of Magnet's events and member benefits. Today on CityCast Madison. The risk of drug overdose in Dane County recently increased. Last week, an overdose spike alert was issued by Public Health Madison and Dane County. To get more details on the spike and interventions folks can take to keep themselves, their loved ones, and community members safe, we sat down with one of the department's public health supervisors, Julia Olson, who oversees the Substance Use Prevention and Harm Reduction team. It's Wednesday, July 23rd. I'm Bianca Martin, and here's what Madison's talking about. Julia, welcome back to CityCast Madison.
Hi, thanks for having me.
Yeah, so earlier this month, Public Health Madison and Dane County issued an overdose spike alert saying that within 24 hours between July 13th to July 14th, there were 5 confirmed overdose response calls from EMS. What triggers Public Health to issue an overdose alert? And is this alert a cause for alarm?
Well, when we set up this overdose spike alert system, it really was a way to try to, I think, identify what do we kind of see, I guess you could say normally. What is sort of an expected daily level of overdose response calls? And then when we go above that, we would issue a spike alert. We set up this alert system really years ago because we also wanted to make sure that people who use drugs or who were thinking about it would have some more information if there was maybe something out there to be a little more concerned about. So when we first set these up, we were really concerned because we were seeing fentanyl in the street drug supply more often. Fentanyl is a synthetic opioid. It's quite a bit stronger than some other opioids. So people who don't know that's what they're taking, don't want to be taking that, or may have it mixed in with another drug, they could have a pretty bad reaction to fentanyl if they're just not used to taking it. So we wanted to start being able to alert people that there's maybe something out there that could potentially put you at increased risk for an overdose. And here are some steps you can take to make safer choices about use and also be prepared if you are around someone who's experiencing an overdose. What can we do in this situation? So we did see other drug-related overdoses during that time period, but there were 5 that we could confirm were opioid-related and had those symptoms. So when we set up the spike alert system, the criteria was 5 or more in a 24-hour period for EMS responses to opioid overdoses and 7 or more hospital visits in that same time period. So we reached that point when we issued our spike alert last week, but we did have a couple other overdoses or situations that looked like someone having a drug reaction. That might be what we would actually refer to a little bit more as overamping. Overamping is when you get sort of these related symptoms from consuming too many stimulants or stimulants causes this. And so it's a little bit of a different concern with opioids. Opioids were concerned that you're going to stop breathing. Your body's not going to be able to breathe. You need medical attention or, it could be fatal very quickly. With a stimulant overdose or overamping, it looks very different. We might be concerned that someone might have a stroke or a heart attack, or they might start getting psychological symptoms of anxiety and paranoia that can look very different than somebody who is experiencing an opioid overdose. So all of those things, that's why we started the Spike Alert system, again, to give people more information about how to stay healthy, safe, and alive, whether it's someone who uses drugs or, frankly, you're a bystander or you're just a person who cares about somebody who uses drugs.
Yeah, and you mentioned that part of starting this up was when you were seeing stronger drugs in the mix, right? Like fentanyl. Does this spike indicate that there are stronger drugs or like other drugs in the picture at this time?
That is a great question. And honestly, it's really hard to know sometimes. We have very different levels of information about the overdose calls or the hospital visits when we see them. Sometimes people have a lot of information and they can tell you, this is what I thought I was taking. I thought I was taking a Percocet. Or they could say it was a little brown pill. I don't really know what it is. In other situations, a loved one is finding the person unresponsive and you just really don't have information about what they took because either, being transported to the hospital or at the hospital, the person wasn't able to give that information. So it's a hard question to answer. I would say we would suspect that maybe there's something in the drug supply, whether it's fentanyl or there's some other things called nitazines or xylazine where they can lower your blood pressure. And that can cause some reactions that could make you need medical attention. So it's hard to know without a more kind of comprehensive ability to check drugs in the moment or to have that information quickly. But like I said, we worked with a lot of really smart data people at the state and locally to see what is kind of a baseline that we should expect, what's kind of normal. And when we start seeing it creep up, we do look for those things. We do look for, did someone think they were taking cocaine and then they got pinpoint pupils and stopped breathing? That would indicate that that likely wasn't cocaine. There were opioids, maybe fentanyl in there. So we do look for that information. Is there something we didn't expect? We also work with a lot of partners and ourselves at Public Health who operate harm reduction programs, syringe services programs. So we talk a lot to people who use drugs fairly regularly about, are you seeing anything out there? And we get a lot of that firsthand information from people saying, yeah, I got this substance and it was purple and it made me feel this way. We tend to try to share that one-to-one at our programs directly with people who are using drugs so they can use that information to make different decisions and safer decisions about use. But there's a little bit of a difference between what would meet like the threshold for a public alert like this, where we have a lot of conclusive information and, what we might be sharing in kind of a one-to-one with people we serve.
Sure. And so to help put this into perspective, is there a typical number of overdose calls EMS responders are responding to in a given week or month?
So we have been really fortunate in Dane County to see our suspected overdose calls and hospital visits going down over the last 2 years. So there was a point in time when, we started this alert system where we were sending alerts several times a year, like 4 or 5 times a year. We were seeing ourselves kind of pretty consistently bumping up against that threshold where we were just, right on the cusp of issuing a spike. I would say in the past year to 2 years, those numbers have been much, much lower, where we may only see like 1 or 2 in that 24-hour period. We might see other drug-related responses, like someone who's overconsumed THC and is having, nausea, paranoia, or panic attacks, or their heart's racing, so they think they're having an overdose, but it's not the same level of like risk that this could be fatal. So frankly, I've been used to only seeing maybe 2 a day or less sometimes during the past year. Again, I think some of those decreased overdose response calls really do track with what we've seen in terms of our fatal overdoses going down over the last few years.
Yeah. So do we know then what caused this spike or some considerations to knowing what caused it?
Well, I can say that in at least 3 of the people, they thought they were taking pills, pain pills, Percocet, or they said a little brown pill. So again, that's a little interesting for us because we haven't seen those type of press pills as much being the thing people say they think they're taking. I would say back in, 2020, 2021, we would see that a lot more often. Drug trends, they change, they fluctuate. So we'll go through these cycles where we'll see something for a while really contributing, and then, it changes to something else. So that was a bit new. That was something to note, because we hadn't really been seeing pills as much being involved in these overdose response calls.
Yeah, I can't help but think about this time of year and the heat. So unfortunately, Julia, this is not the first time we've had you on the show for this issue. Back in the summer of 2023, there was, like you said, another string of overdose alerts that unfortunately included fatalities. Is there a seasonality to this? And where does heat factor in?
Well, it definitely can. So the heat can definitely exacerbate some of these symptoms that you see pop up when you take drugs. Opioid withdrawal can make somebody more susceptible to getting a heat-related illness. Some of the stimulants, some of the other drugs that people take, it certainly can, again, put you more at risk for heat stroke. And actually what I was talking about with overamping or someone who's over-consuming stimulants, one of the things that happens there is your body temperature goes up and your heart rate goes up, and you might get the chills, and you might be sweating profusely or not be able to cool yourself down. So again, if you are, someone who's taking cocaine, you start experiencing those symptoms and it's 90 degrees outside, that could, make that even worse for someone. So I definitely don't want to downplay that. Heat can definitely impact people who are taking drugs, whether it's heroin, cocaine, or frankly, alcohol or THC. To stay safer, I would always recommend to people hydrate, hydrate, hydrate. Get a lot of water. Try to make sure your body is physically in a good place to deal with whether it's the heat or the combined, heat plus taking a substance. Get lots of water. Try to keep yourself cool. And always would say, go slow. You can always take more later, but go slow and try not to put that strain on your body if you're going to be consuming drugs. I think another thing to know about the summer, we, get a lot more people that come to the area in the summer. People are out and about more. I think, there is just going to be a level of kind of increased drug activity. Folks who are selling drugs are going to be out and about more. They have access to more people. Those are all things that are true, and we're going to see in a lot of places. We see more overdoses in general happen in the evening and weekend hours than, say, we would on, Monday at 5 p.m. They still happen then, but we're going to see them more during those periods of time where, again, people have the free time, they're out and about, they have more access.
Socializing.
Yeah, socializing, those type of things. A lot of times these drugs can be very social things, and you'll see groups of people doing them together. So, I think that's just sort of to be expected. Since we started the spike alert system, I can't think of a time where we haven't at least issued 1 or 2 alerts during the summer months.
Well, at this point, the dangers of drug usage, particularly when it comes to opiates, is much wider known because the issue's just in the public eye. Administrations have waged a war on opioids. In recent years, pop culture has tackled the subject with shows like Painkiller, Dope Sick, and Euphoria. Major books have been written about this issue. With these consequences, so prevalent in the public eye, have you seen any changes in usage trends over the years?
Yeah, well, like I said, everything kind of comes in waves. We've gone through periods where, first it was heroin, and then, it was painkillers. Then it was pressed pills, and then it was kind of the rise of synthetics. And now we're still seeing, the synthetic drugs like fentanyl involved in, and opioids involved in the majority of overdoses. But we're kind of seeing it level off a little bit and starting to see other drugs like stimulants and cocaine being involved more in overdose deaths. And we're also seeing the way people are using their drugs change. Nationally, this past year, when CDC put out their latest data, we're seeing more people who had fatal overdoses who smoked their drugs versus injecting. And that's a big change in terms of the method of use, right? I think you're right. There has been so much attention related to opioids that people know a lot more about it. But I also caution a little bit sometimes the way media presents it, because, I think back to like the Faces of Meth campaigns back in the earlier 2000s, where it was more a way to kind of stigmatize and present these scary images of people who use this substance. To what purpose, though? It definitely wasn't to try to support those people in living a healthier life, on a recovery journey, or whatever positive change it was they were maybe looking for themselves. So in some ways, it's a good thing there's so much more visibility, but I do think we could all still do better in trying to support positive changes for people, whatever that may be. I think what we could all in this space do a little bit better job of is, again, starting to educate more about stimulants, because like I said, not many people have any idea what it means. If I said overamping, you're like, what on earth does that mean? Or they think you can't overdose from cocaine or from meth. But you can definitely have what we would call cardiotoxicity, which is the combination having almost a fatal impact on your heart. Your heart gives out. And so it looks different what the health risks would be, or what we would be worried about for someone who is using, say, a stimulant versus opioids. And so I think that we definitely need to do more to educate people on what that looks like, because I think there's just very little awareness when, like you said, there is this bigger awareness of opioids. A lot of people know what Narcan is. They know that there's places I can go to get this for free. They know more about what to do if they think someone's overdosing or having an opioid overdose, but wouldn't really know what to do if meth is involved or cocaine or they're seeing something else.
Looking for a new way to play outside? American Players Theater in Spring Green is Newsweek's 2025 Reader's Choice Award winner for Best Outdoor Theater Performance, and for a great reason. With 9 plays on stage, there's a story to suit any mood. You can see Shakespeare Under the Sky and Stars in the large outdoor Hill Theater, or a world premiere in the intimate indoor Touchstone Theater that offers climate control and no mosquitoes. Whatever path you choose, it's a unique way to spend time outside with your favorite people. Pack a picnic, because gas grills are available for your grilling pleasure. And enjoy hiking trails for a little post-meal activity before you see some world-class theater. It's time for you to see why the New York Times calls APT a, quote, Wisconsin treasure. Best part, dear friend and listener, you get 20% off your play tickets with the code CITY20. Plot your summer play date at AmericanPlayers.org and thank us later. Remember that amazing little cafe you discovered last summer with the perfect latte and crazy view? Or that sweet hiking spot your friend told you about but you can't remember the name? With Overlook Maps, special places never get lost again. Create personal lists of places you've been and want to go. Build your must-visit list for your next vacation, your foodie favorites for date nights, or your weekend getaways when you need to escape. Share your favorite hidden gems with friends and family. Let them discover that incredible barbecue joint you found, or that scenic overlook that takes your breath away. Or keep your secret spots completely private. Planning a trip with friends? Create a shared list where everyone can add their ideas. Visiting a new city? Check out lists from locals who know the real gems, not just the tourist traps. And here's the best part. No ads cluttering your lists. No one selling your data to advertisers. Just your personal collection of amazing places organized exactly how you want them. Overlook Maps, collect, organize, and share the places that matter to you. Download free at overlookmaps.com and check out overlookmaps.com/Madison to see some of our lists and great spots on a map and in your pocket. Your places, your way.
This episode of CityCast is sponsored by Babbel. Learning a new language opens the door to new friends, new cultures, maybe even a whole new life. So why not start that journey today? You can start speaking a new language with confidence thanks to Babbel's conversation-based technique that quickly teaches you useful words and phrases about the things you actually talk about in the real world. I'm CityCast CEO David Plotz, and I've been learning Spanish with Babbel, just one of the 12 languages you can learn with it, including Dutch, French, Italian, which is going to be next for me, Turkish, and Russian. I love the interactive dialogues that Babbel has, which allow me to practice what I've learned right away, and also the speech recognition function, which makes sure I'm getting the pronunciation just right, which honestly, usually I'm not. Also, I love that Babbel's lessons always cover actual things that I talk about in the real world, like food, talking to people I've just met, and also food. Staying motivated to learn a new language has never been easier thanks to real-time feedback, progress trackers, and handy visualizations in only 10 to 15 minutes a day on Babbel's mobile app or website. So get talking with Babbel. I want you to learn another language, so I'm teaming up with Babbel to gift you 55% off subscriptions, but only for our listeners at babbel.com/citycast. Get up to 55% off at babbel.com/citycast. Spelled BABBEL.com/citycast. Babbel.com/citycast. Rules and restrictions may apply.
I do just want to put appreciation on your emphasis and potent point about having the wrong messages out there in some of the campaigns of the past and still in some of these TV shows and this stigmatization of individuals who are doing drugs. Let's be realistic. People are going to do drugs. There's no way around that. And so talking about it in a way that's person forward and actually might have some efficacy and making change and saving people's lives and improving their lives is a really good step. And I do want to talk about sort of immediate short-term solutions for folks who are using drugs. You know, what are some of the things people can keep in mind when it comes to staying safe if they are using drugs?
Yeah, for someone who is using drugs, some, basic things, have naloxone or Narcan, brand name. So they're the same thing, comes in an injectable form or in a nasal form. There are many places throughout Dane County, pharmacies, vending machines, public health offices, safe communities, Kaya Clinic, Compass, community pharmacy. There are so many places that you can get naloxone for free.
And for those who don't know what that function is, what does naloxone or Narcan do?
It is a life-saving medication that will help to restore breathing if there's an opioid overdose. Opioids, they bind to your brain. They shut down your body's ability to do certain things. Breathing is one of those. And really what naloxone or Narcan does is it kicks that drug off the part of your brain and starts restoring your ability to breathe and function. So it is not going to hurt or do anything to someone if there are no opioids involved. When in doubt, give naloxone, give Narcan. If you think this could be an overdose and it ends up not being an overdose, you are not going to hurt them by giving it to them. You can give it to children. You can give it to dogs. Most people are more comfortable doing the nasal because it looks just like a nasal spray you would get if you have allergies. So it's actually, got it sitting right here.
Yep, it looks just like an allergy applicator.
Looks just looks like an allergy applicator. So that would be my first thing. People who come to see us at the health department or see any of the partners that I just mentioned who do work with people who use drugs might often say like, oh, I don't do those. I don't need it. I only use cocaine or I use meth. We give a lot of messaging of you never know what is mixed in with the drugs you're taking, and there's no way to guarantee that what you want to get is actually what you're getting. So have it available, have a safety plan, have a plan in place that someone knows when I'm planning to use drugs. And if I go unresponsive, they know what I want them to do. They know where the naloxone is. Again, if you are not a person that's using drugs, but you're concerned about someone you love who you think is, just have it in your house, have it available. It's not going to hurt anything, and it could be a life-saving measure for someone. We often tell people who are using drugs to please try not to use alone. In most of the fatal overdoses that we've seen over the last few years in our overdose fatality review, the person was alone. There was no one there to respond, or they were, say, in a house, but in a room locked away from everyone where nobody had awareness of what they were doing. So if the worst happens, nobody could intervene. So we always say never use alone. There's a national hotline number for Never Use Alone, which is an organization who has peers who will stay on the phone with you and talk to you. And then if you stop responding, they'll start enacting your safety plan, whether that's my mom has naloxone and can respond. The first thing you do is call her, or it's if I stop responding, call 911 right away. And here's where I am.
I know that's saved a lot of lives.
So those are kind of the first two things I would say is have naloxone and don't use alone. Make sure you have a safety plan if you're using drugs. There's also fentanyl test strips and xylazine test strips. So if you want to test your drugs, if you want to know, have a better idea of what's in there, there are methods to do that. Then you have to decide if you're still going to take it. What are you going to do if there is fentanyl in there? And again, people who go to harm reduction programs, often staff will ask them that question, like try to help them talk through these things first so they're not trying to decide in the moment. Again, if you are a family member or friend, you're concerned about someone who you think might be using drugs, there are so many resources in Dane County that could be helpful in supporting someone, again, to take steps to be healthier and safer, whether that's someone who wants to, cut down on their use. Maybe they want to stop injecting and using a different way. They don't want to use around their kids or family, whatever it might be, or they want to completely stop using. There are recovery coaches, there are peer support specialists. We are a very resource-rich community in Dane County, but I think where people could be helpful is helping get people connected, because we do know that's the hardest step, getting people connected to resources or even knowing what they are. So again, Behavioral Health Resource Center is a great place to help someone just navigate what that is and what it looks like and what's available, whether that's for yourself or for someone you care about. Those are some of the things I would say up front. For safer use, we always use that messaging of, try to use a little bit less, go slow. That's the same thing I would say to people who are taking THC gummies, one at a time, space it out, take a little less, because the amount of EMS calls we have for people who are taking THC gummies and don't realize that you swallow it, it's taking a little while to take effect, take a handful, and all of a sudden they are hallucinating and have no idea what's going on or starting to feel really ill. It's the same messaging I'd give. Go a little slow. Again, make sure you have someone with you, though, that if you do start hallucinating, if you do start having a panic attack, they can be there to be calming and help with any safety measures or interventions that are needed.
Yeah, I think people, especially with those gummies or the THC drinks, things that are accessible and legal, even in our area, like it's so easy for people to just say, oh, I'm just going to take the whole thing. Like, why not? It's just a small gummy, but depending on how much you take or how much you drink, like it can hit you really fast and, be a safety issue for sure. I'm glad you talked about harm reduction because I did want to hear a little bit about long-term solutions from the public health perspective. Harm reduction is really important.
Yeah, well, I would say there's no singular thing that is going to solve the overdose crisis. There's no one strategy. There's not one singular agency. It really is a community effort across the lifespan that supports many, many different needs, from prevention, whether it's trying to prevent someone from ever starting to use any substance or delaying the age they are when they start using that substance, to trying to give more education and information about how do you reduce your risk if you are using these drugs, to then giving them multiple pathways in a non-judgmental and supportive way to support any healthy or positive change for that individual or for their family. And I think, again, we do have a lot of great programs like the peer support specialists, recovery coaches. Kaya Clinic is a harm reduction therapeutics clinic. Tellurian. I mean, there's so many more that I could name where maybe abstinence isn't the only focus, because I think sometimes in my experience, back when I was a therapist, before I kind of started working in the public health realm, sometimes people are completely overwhelmed with thinking that if abstinence is my only goal, there's no way I can meet it. And, again, when you're talking about opioids, your body and your brain physically change. And sometimes without these or without medication-assisted treatment, you can't feel actually well and healthy and go about your day-to-day or go to your job or do anything without that substance. You will get extremely sick. And I think that sometimes that's what people don't always realize when they're thinking the only solution if you are using drugs is that you need to enter a 12-step program and an abstinence-based recovery process. And I think the partners in Dane County are wonderful at knowing there are many, many complex needs, and there are different ways that we can help meet those needs, again, to make positive changes and to reduce overdose deaths, because they're all preventable. And I think that's the stance that we've all taken, is every one of these is preventable, and there are things we can do to change our systems to better support people so that these things don't happen, that nobody is losing a friend, a family member, a father. Kids aren't growing up without parents because of an overdose, which was preventable. And I think that we have tried to look at these challenges from so many different arenas. And now with things like the opioid settlement dollars, there's more opportunity to invest differently. You don't just have to rely on a federal grant to come out or the city or the county to put more tax dollars into a certain project.
Yeah, and for context there, for folks listening, Wisconsin is set to receive more than $780 million in total funding as a result of national litigation against the pharmaceutical industry, right? All of the harm those caused, and distribution of those funds are in progress. So
yeah, thanks for adding that, because that is definitely funding that's going to help support, like I said, these new strategies or trying to grow something that really is working to support more people, and also to address some of the inequities that we see for different people in different communities in Dane County that maybe aren't having the same outcomes, that aren't, getting the benefit of this very resource-rich community that I've mentioned. I would say there's a lot in the works. There's a lot of planning that's going on. There's a lot of, engagement that's going on. And again, we continue with the overdose fatality review. There's over 40 partner agencies that are working together on that to look at what are our systems changes, policy changes, just different things that we can do to try to better support people and make changes that we know will have the biggest impact.
Well, Julia, this has been a tremendously informative conversation, and for an issue that has hit so close to home to so many people. And so thank you for your incredibly thoughtful and well-organized and clear messaging on this. I know much work goes into that, and all the work that you're doing for the county and everything that you shared. It's very heartening, and appreciate your time.
Thanks for having me.
That's Julia Olson, Madison and Dane County Public Health Supervisor with the Substance Use Prevention and Harm Reduction Team. If you want more information about the Madison and Dane County drug overdose resources we just discussed, head to our show notes for a link. That's all for today here on CityCast Madison. I'm Bianca Martin, your host. If you enjoyed the show, why not share this episode with someone you think could use or might need these resources? Remember, it never hurts to ask for support. Thanks for listening, and don't forget you can support our show by becoming a CityCast Madison neighbor at membership.citycast.fm. We'll be back tomorrow morning with more stories from around the city. Until then, take good care of yourself and each other.